Good morning. Today we're going to be talking about the bleaching epidemic, something very interesting and very unusual. Good morning, Dr. Cole-Adeife and Dr. Abiri. It's a pleasure to have you both with us.
Thank you.
Good morning.
Thank you. If I can start with you, Dr. Cole-Adeife, you're a dermatologist. Why?
Yes.
You know, a little buddy told us that the National Association of Dermatologists is launching something called the bleaching epidemic. Why? Why the bleaching epidemic? I mean, that sounds so dramatic. What's it about?
Yes, it's an anti-skin bleaching campaign being launched by the Nigerian Association of Dermatologists and supported by Eucerin. And it's very important because 2 years ago, the NAFDAC actually declared that, there was a serious emergency with the problem of skin bleaching in Nigeria. And so as dermatologists, the specialists who deal with this problem the most, we decided that we were going to go on a campaign to try to reduce the number of people that engage in this very harmful practice. And we're beginning to see a lot more people in our clinics with the complications of skin bleaching, including children. And that is what has been very worrisome for a lot of us. And so we really need to go into the public and make efforts to educate people and discourage people from engaging in skin lightening, skin bleaching, skin toning. It has many names, but it's all the same thing.
Actually, very interesting to say that because in fact, just on my own, I asked one or two people, what is toning? And everybody doesn't think that toning is bleaching. It's so actually so amazing that people think toning is fine, but bleaching is not. So tell us, what is bleaching and why is toning and bleaching the same?
Well, because I've never seen a cream or product that actually says it's a bleaching cream. And so people know that the word bleaching has some negative connotations to it. And so a lot of marketing shies away from using that terminology in selling or marketing their products. So they look for other euphemisms like tone, like bright or light or white or fade, but it's actually the
Or
content.
glow.
So
Forgot
there
the
are
glow one.
of or
Glow.
glow, yes. And there are actually toners, which are, skincare products that are safe and healthy that people use as part of their skincare routine. After washing, maybe with a harsh or alkaline cleanser, the toner helps to bring the pH back. And that's fine. But when you talk about creams that tone, then there's a problem because what it essentially means is that the cream is changing your skin tone or your skin shade, usually to a lighter shade. And that's essentially bleaching. But because it doesn't sound as, bad as bleaching, people think toning is different from bleaching, and it's actually just six and half a dozen in most cases. But the challenge is that most people feel, oh, some parts of their body are darker than other parts, and so they want to like even out their skin tone. And so when they see tone, they feel, okay, that's the best way to do it. But actually, the people marketing these creams and products are just preying on the ignorance and then the desires of people, to even out their skin tone. And there are ways to even out your skin tone without bleaching your skin.
Now, it's very interesting because as fair skinned individual myself, I have different colors at different parts of my body. I think it's quite natural, actually. Particularly if
Absolutely.
you have melanin. But some parts, the parts exposed to the sun, are darker naturally than the parts that are not exposed to the sun. It doesn't matter whether you're light or dark. It's just a fact.
Absolutely. And a lot of people don't realize this, that the sun actually slightly tans your skin. So the parts that are constantly exposed to the sun are going to be slightly darker than the parts that are always covered by clothing. And then for dark skinned people, areas that have friction, like the underarms, sometimes the in between the thighs, may be slightly darker as well because of the friction of the two parts of the skin rubbing together from time to time. And that's also normal in most people. But most people have the impression that your skin needs to be the same color from head to toe, which is wrong. And a lot of people who sell these products actually, prey on this wrong notion to market creams that, oh, you have the same color from head to toe if you use this product. So that's one of the reasons why we're going on this campaign, to educate people about what healthy, good skin is like. Even with white people, the parts of their body exposed to the sun are slightly darker than the covered parts. It's the same for everyone, and it's normal. So people just need to understand this and manage their expectations about their skin so that they don't end up, going down the rabbit hole of skin bleaching.
So what is skin bleaching and why? What is it exactly? And why is it so dangerous? Why are we worried about it?
Well, skin bleaching is the use of certain agents, whether topical or systemic, that's maybe oral, now injections, to change the color of the skin, usually to lighten the skin. And we term it skin bleaching when the skin is healthy, the skin doesn't have any, major concerns, and you just want it to be a lighter shade. Now, sometimes you may actually have a reason to use what we call a depigmenting agent if you had a skin condition that left you with dark marks or dark spots. And this is a medical condition that's treated by dermatologists and aesthetic physicians. And after the treatment is done, you stop using the products, just like we use antibiotics for a period, and after that, we stop. So there are times when some agents are recommended to treat dark marks and dark spots, and then after that, we stop. But where you're using the same agent on a day-to-day basis, where you don't have any dark spots and you just want your skin tone to be lighter than it normally is, then you call that skin bleaching. And people can use creams, they can use soaps, they can use oils, they can use injections, they can use tablets. There are several agents, that are being used to lighten the skin these days. And some of these agents are medical treatments that are being abused for the purpose of skin lightening. And why we're kind of concerned about this is because just like every medicine can become a poison if it's used wrongly or overused, the same way that a lot of agents used for skin lightening, if used or overused, can lead to severe consequences or side effects on both the skin and the systemic health. For instance, a lot of people use corticosteroids topically to bleach their skin. Now, we dermatologists use topical corticosteroids to treat certain skin conditions, but it's for a controlled short period. Where you begin to use these corticosteroids for months and months and months for skin lightening, it can damage the skin permanently, lead to things like stretch marks, thinning of the skin doesn't heal properly, and can lead to infections because the immunity of the skin is suppressed. And some of these corticosteroids can be absorbed into the bloodstream, can raise the blood sugar, can affect hormonal imbalance, and can also even lead to things like diabetes and hypertension long-term, or some hormonal conditions like adrenal insufficiency. So these are some of the things we're beginning to see in people who have used these kind of products to lighten their skin, and then they develop some of these infections and skin complications, as well as some systemic complications. And in children, it can, corticosteroids used this way can affect their growth, so they don't grow properly. It affects the growth plates in children. And we're seeing a lot of children now using these strange new products, Teens and Glow and Fairchild and all kinds of things, which are very concerning. And some of these children are beginning to come in with the adverse effects of these products. So we're really concerned because these are totally preventable health conditions in a country where we are still struggling with our health system. We don't want to burden the health system further with totally preventable issues from, skin bleaching agents and things like that.
Yeah, Nigeria is supposed to have a higher than normal rate of kidney problems. And a lot of fingers are being pointed at some of these bleaching creams. Is this correct?
Yes, actually, we do believe that. We just need to do a bit more research. But it is not, it is most likely, and it is not, it's something that we as dermatologists see, particularly someone like I that work in a teaching hospital, and I still get to see medical cases and kidney cases and nephrology cases. I see a lot of the females who are on admission with kidney failure, and you can see the adverse effects, I mean, the side effects of skin bleaching in a lot of these people. So there is definitely some, and then of course, with mercury containing products, mercury is known to be toxic to the kidneys. Now, mercury has been banned in most products, but there are still a few studies that have shown that certain skincare products in Nigeria still contain some mercury. And so it's very likely that if people are using mercury containing products, they could actually be contributing to, the kidney damage. And then, of course, if it's happening from an early age, then they're growing up with using these mercury containing lightening agents. Yes, it's probably a straight line from that to skin lightening, but we do need more studies, evidence-based studies to affirm this.
Thank you very much. Dr. Abiri, some people might wonder, why do I have a psychiatrist in this program? After it's a program about skin. But I'd like to ask you, from a mental health perspective, why are people bleaching their skin? Why do people want to change their color?
All right, then. So the honest truth is that many people have different reasons for wanting to bleach their skin. Why one person might want to may be different from why another person wants to. More often than not, however, the bleaching of the skin may not always be connected to just their color. What we find in many situations in individuals who bleach and perhaps have, mental health connections is that it's often about self-perception, low self-perception, low self-image, and low self-esteem. And of course, when all of those things are low, their confidence levels are low as well. Beyond self-perception, self-image, self-acceptance, and the fact that individuals, of course, think that being light-skinned is quote unquote socially acceptable. It's more socially acceptable. So I think that what society has also done is that society has allowed people to come to a place of thought where they think that before you can be a video vixen, for instance. So a couple of people have said, for instance, that when they go for auditions, if they're dark skinned, they tell them that they're not attractive enough, they're not good enough for the fit. And so they're more likely to want to turn to ladies who are light skinned and quote unquote more attractive. So more often than not, society also dictates what people tend to do with their skin. A need for belonging and acceptance is also something that pushes people who bleach their skin or tone their skin or lighten their skin to want to do it as well. They want to be accepted into society, again, meeting society's value and standards as well. In addition to that is the fact that sometimes people believe that being lighter brings better treatment, better relationships, better opportunities, or better jobs as well. Again, if we liken it to the video vixen thing, more often than not, it is said that people who are lighter are more attractive, they're more likely to be noticed as compared with other people as well. And then, of course, when life feels unfair to some individuals, you'd be surprised that some individuals actually feel like, oh, life is unfair because I'm dark-skinned. I'm not getting these opportunities because I'm dark-skinned. And so because of that, they want to be in control. They feel like this is something that they will be able to change by themselves. And if the one thing that they can change in that moment is their skin, then they'll go ahead to change it. Of course, we mustn't remove the fact that absorbing repeated signals from the environment, especially from people around them, even in families where there's one light-skinned person, people are more likely to, gravitate towards that individual as compared with everyone else. And so the dark-skinned person is likely at risk of thinking that they're not enough. Again, they tie their worth, their value to how their skin looks because they believe that light skin equals beauty, it equals success, or it equals worth. For some people, however, bleaching is a form of a coping strategy that is shaped majorly by external pressures, external validation, and not always by vanity. So if we wanted to look at, psychological reasons why people bleach their skin, this may be some of them.
At what point does bleaching become something like a compulsive or addictive behavior?
So on its own, ordinarily, of course, it's problematic. It's problematic because it's a huge public health concern, not just for that individual, but for the myriad of healthcare professionals that the situation or what it is that they put themselves into, bleaching at this point, will bring them in contact with. However, we can say that it becomes compulsive or addictive when the individual cannot stop in spite of health risks that they can see. So for instance, most times the one thing that we're more likely to see, and the dermatologists are the ones who see this, and probably people around who knew this person previously, is that the skin starts thinning out. There's a lot of striae, the skin looks very unhealthy, the skin bruises very, very easily. I remember then in emergency, when I was an emergency doctor, and I used to have individuals who had accidents, when they had, cuts, people who had bleached their skin, it was so difficult to be able to suture their skins. So when you have an individual who is able to see all of that damage being caused to the skin, yet they cannot stop, that bleaching is becoming compulsive. Another point as to when it's becoming compulsive or addictive is individuals who go into panic mode or a mode of distress. After a while of marvel when I see people accept just about anything from just about anyone just because they want to lighten their skin. We watch a lot of the social media videos where you see they're having all sorts of baths, they're taking all sorts of injections from individuals who are not even healthcare professionals. That, of course, is concerning. And of course, it's becoming compulsive or addictive when the situation causes them pain, it causes damage, it causes social withdrawal. Again, it's causing a lot of harm to their health. They're spending so much money. They're using a lot of products. It's landing them with one doctor or another doctor, and these individuals cannot stop. So, of course, at this stage, what we find is that the behavior has moved from a choice, from something that they decided to do, to a compulsion. And that compulsion at that time is often driven by fear, by shame, or just to have an identity that is associated with someone who is light-skinned.
That's something that's big. That's really big. And I mean, how is it also linked to that anxiety, depression? And there's something called the body dysmorphic disorder. What is that? And why is that bleaching?
Well, so the body dysmorphic disorder, in addition to, anxiety and some other stress-related disorder, the body dysmorphic disorder is actually one of the disorders that we call the somatoform disorder. But if I were to put it very simply, it is the body, or rather the mind, that hates the body. So an individual looks at themselves and that they are convinced beyond reasonable doubts that there is something not quite right with their bodies. If I asked everyone on this call today, is there a part of your body that you don't like? Yes. Somebody might say, oh, my tummy is too big. Oh, my nose is too small. Everybody will have something that they don't quite like. But the individuals with body dysmorphic disorder have a delusion, a fixed belief, and almost always it's false in their own situation because they have an exaggerated thought that there's something wrong with a certain part of their body. And they will go to any lengths, including surgery, to ensure that they, put that defect, they correct it. More often than not, what I have found with plastic surgeons or cosmetic surgeons who go ahead to do some of this cosmetic surgeries for young ladies, is that I found that quite a number of these young ladies actually have the body dysmorphic disorders, but sometimes the surgeons don't know. And so they just go ahead, put them under the knife. But regardless of what you do, they are never content with what you've done. And so the question that you had asked is, what is the link between anxiety, depression, and body dysmorphic disorder? Then the truth is, the individuals who have anxiety have a fear of not being enough. They have a fear of rejection, or they have a fear of being bullied. The individuals who are depressed, of course, feel a sense of shame, a sense of hopelessness, or chronic dissatisfaction with themselves. But you see, when it comes to body dysmorphic disorder, the individuals are intensely preoccupied with a perceived flaw in their skin tone. Since we're speaking specifically to bleaching at this point, Others may not see it as problematic, but they believe to a very high degree that you can't see it, you don't understand. It's because it's not in your body. That's why you don't know that there's a problem. And so, again, of course, it's important to emphasize that not everyone who bleaches their skin has a mental health problem. However, more often than not, what we found is that individuals who then go ahead to bleach their skin have emotional distress that they can't control, and they just need an outlet or something to make them feel satisfied at one point or another.
Wow. Now, because it's clear that bleaching is bigger than we all thought. It's not just a small thing in the corner. It's not just picking up a cream or two. It's massive. It's actually also driven by society. Now, we have a couple of minutes left. I mean, this is something we need to talk about more and more, but how do we overcome it in society? You know, I just, if you can just use that for your last words, is how do we overcome it? This is colorism. And how does this social pressure is affecting the mental well-being of a lot of young people? So how do we overcome it?
So what I would say from my own point of view, as psychiatrists, mental health experts, is that whenever we see individuals who are bleaching their skin or have a reason to want to bleach their skin, it's important to ask why. More often than not, society is also judgmental. You'd find that society is amazing. It's funny. Society will push you to a point. Society would also run away, from your back. And so the society that you thought was behind you and urging you on, after a while, you look back and there's no one there. And so you must always ask them why, not be judgmental, be kind to them and understand their reasons. We should always try to screen for emotional distress, self-esteem issues, and of course, unsafe practices. As healthcare professionals in my line of work, I think it's extremely important to provide non-judgmental education about risk and alternatives. Conversations about body image and identity into routine care. A lot of young people these days do not like their bodies, regardless of how seemingly perfect those bodies look. A lot of young women, a lot of young adolescents, and a lot of young girls also don't like their bodies as well. And of course, we must work together, work in hand. There's a dermatologist on the call. Again, I think that we're in great company. Thank you.
Thank you so much. So your last words, Dr. Cole-Adeife, on this subject.
Yes, I'd just like to add that there is some socioeconomic aspect to it, because people have mentioned that they feel lighter skinned people have better economic opportunities and social capital. Things like getting jobs more quickly, or even marriage. They, are more likely to be married and to get married earlier. And so we need in a society to have a rethink, or to have a paradigm shift in some of our social cultural norms. Is it true that people who are light-skinned have better economic opportunities? And how can we level the playing field to ensure that people, no matter what the color of your skin, you get the same opportunities, with everyone else? And I think that will help to reduce the need for a lot of people to lighten their skin. When young girls begin to see people who are dark skinned on billboards, in television shows, as celebrities, and people that they can aspire to be leaders, and they see people who are the same skin tone as them, succeeding and doing great things. Perhaps those people can be role models, because there was a time every single billboard in Lagos, was light-skinned females, and that has its effects on people's psyche and mindset. And so we need to have a society that's inclusive and celebrates all skin tones and skin colors, because all skin colors are beautiful. Every skin tone and skin type is beautiful. And so we shouldn't discriminate and put pressure on people to lighten their skin tone for whatever reason. We want to also emphasize that most skin lightening products are harmful to the health. And so we want to make sure that people are aware of these harms, so that they make informed choices, even if they do decide to lighten their skin. And then when it comes to children, it should be a no-go area for skin lightening and skin toning, because this just brings nothing but harm and damage to the health of innocent children.
Yes, thank you so much, both of you. I think this topic really needs to be addressed over and over again. And I want to appreciate both of you for bringing this to the fore. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.